2020, the world is locked. Within a few weeks, the crisis caused by COVID-19 has affected the entire planet. This is the first major pandemic of the 21st century. This may not be the last. The potential for outbreaks exists at all times.
We are aware that land use changes like urban expansion, agricultural intensification, and reforestation can influence zoonotic disease risks.
Most pandemics start with the emergence of a new disease from animals. The risk of coming into contact with animal infectious diseases is increasing as the environment and wildlife are becoming more and more threatened. There is a way to stop this: prevention. By taking an integrated One Health approach, which sustainably balances and optimizes human, animal, and ecosystem health, we can reduce risk, enhance surveillance, perform early detection, and avoid spillovers. This is the role of the international initiative PREZODE. Launched in 2021, PREZODE encompasses a variety of expertise to break silos and offer a comprehensive approach to health risks.
What we need is really primary prevention, that is, preventing the disease emergence to occur.
We are epidemiologists, medical practitioners, sociologists, veterinarians, biologists, virologists, economists, anthropologists, ecologists, or civil society mediators. We are taking actions in the field worldwide to implement PREZODE's scientific framework and develop impactful solutions. Community-based surveillance is one of the key actions that strengthen health systems and prevention, especially in places where people are highly exposed.
With the PREX program, we support community-based surveillance in 16 low and middle-income countries, where we work hand-in-hand with the local stakeholders to build trust and co-design solutions adapted to their needs. This includes training communities in detecting early health risks in animals, human environments, or strengthening capacities of animal health workers in veterinary techniques where veterinary services are scarce, but that can also be in the form of strengthening civil society engagement in One Health decision-making.
Costa Rica has been part of PREZODE since its beginning. With a strong history in conservation and solid public health and education system, the country now faces complex challenges. Through ASANCO, we bring together communities, government, and academia under a One Health approach to co-design sustainable solutions.
Reducing the risk of emergence is also by multi-stakeholders research through the PEPR PREZODE projects, which cover a wide range of scientific approaches using both pathogen-centered and ecosystem or host-focused perspectives.
This program brings together 11 projects, multiple research institutes, and a truly interdisciplinary scientific community. Our mission: understand what drives zoonotic risk, co-design prevention strategies with those on the front line, and build smarter surveillance systems with innovative early warning tools.
The key area of Cameroon is a biodiversity hotspot with important zoonotic risks. Local communities consume bushmeat, including bats, known to host diverse coronaviruses that remain unaware of spillover risk. However, we can already see progress of our research on zoonotic risk reduction.
Since 2025, PREZODE endorses existing projects that align with our values through its labeling program to facilitate coordination and knowledge sharing. PREZODE's DNA is all about collaboration. Our international working groups bring together experts to advance research and knowledge exchange. Their activities are guided by the co-designed strategic agenda, ensuring alignment with shared scientific priorities. Together, they build on and update the needs defined during the 2021 to 2022 co-construction workshops that laid the foundation of PREZODE's vision and mission.
We collaborate with diverse experts to strengthen community voices in co-designing solutions that support PREZODE's prevention-focused mission.
Within working groups, We have identified priority in zoonotic prevention through advocacy, research, and dialogue. Our work shows that inclusive and One Health approaches are essential to building fair and robust systems that reduce zoonotic risk worldwide.
Through the International Data Working Group, we're looking to shape a flexible platform that will support genuine research collaboration, with a particular focus on ensuring that scientific outcomes can be effectively shared with communities and that paths exist to capture community knowledge within One Health research projects.
We work closely with international organizations through joint working groups with the World Health Organization, the FAO, or the World Organization for Animal Health to ensure that science innovations nourish and are embedded into international reference framework. We thrive on co-designing solutions with a bottom-up approach, as we recognize that sustainable solutions and responses must be developed by and for the people at the front line of risks.
Aujourd'hui, nous nous concentrons sur la rage, une maladie mortelle mais évitable.
We promote a continuous science, society, policy dialogue. We engage at the highest international level to advocate for our values.
I therefore declare that voting is opened.
With our partners, we pushed for the integration of the One Health concept and prevention in the pandemic agreement adopted in May 2025. 5 years after the launch, thanks to the support of our founding institutions and engaged members, PREZODE has built an inclusive and impactful initiative. Our 280 members worldwide are governments, research and academic institutes and universities, decision makers, civil society organizations, foundations, private companies, or other initiatives. International collaboration, cooperation, evidence-based and data sharing are key to ensuring a healthy planet. Prevention is the most cost-efficient way to protect our health. All health. One Health. Join PREZODE.